Hi, my name is Claudia Schaefer, and I will be presenting on executive function and TBI. Pathophysiology. TBI is a result of trauma to the head by either a stationary head being hit by an object or a moving head being forced to suddenly stop or accelerate, such as in a car accident. And prior one could be caused to a bullet entering the skull. You can either result in either a penetrating head injury, meaning there's some kind of fracture in the skull, or a closed head injury. Prevalence of TBI is considered actually a global epidemic. It's estimated that at least 10 million people have been hospitalized or died due to TBIs in the US. There is 1.4 million occurrences, and out of that, 235,000 result in hospitalization, 500,000 in deaths, and it is believed that 5.3 million people are living with TBI in the US. Their causes, the incidences are believed to be 1 in every 100,000. Those are for patients receiving treatment. If you count those patients not receiving treatment, it could be as high as 250 in every 100,000. And it's believed that 2% of Americans live with TBI, and it is most likely that males versus females suffer from TBI. As you can see, the causes, the number one cause is falls, followed by motor vehicle traffic accidents, being struck by something or against something, and followed by assaults. The severity, there's different types of severity scales that can be used in the onset of the occurrence, and also to monitor the patients. One of them is the Rancho Los Amigos severity scales, and patients are rated and are depending on their level of awareness and responsiveness, attention, and they are put in a certain level depending on the severity scale. This is an example of the Rancho Los Amigos severity scale. Impairments can vary. One of the impairments is attention, and that's maintaining attention, alternating attention, and discriminating between foreground, background. Another impairment can be memory. This could be traumatic memory loss, or it could be post-traumatic, meaning it's more likely that you're going to recover your memory loss from the prior to the incident happening, and that more people actually suffer from post-traumatic memory loss, meaning that they have impairments with their memory after the incident. Another impairment can be visual processing, and this is common in the early stages, but depending on the location of the trauma, it could also continue to affect visual processing. Executive function skills can also be impaired, and could also actually last, into past, the incident, past the, person leaving the hospital, and different things that can be affected with executive function include mental flexibility, adaptation, disorganized behavior, and it's also been shown in MEG scans that your brain actually is not activated as efficiently in the frontal and occipital lobes regions of the brain. Language and communication can also be impaired, and depending on the severity of the trauma will depend on whether you even have any coherent speech. As using the Rancho Los Amigos severity scales, the higher you go up on the scale, then you start having more comprehensive speech, but then other language impairments occur, which could be irrelevant speech, word retrieval problems. Other physical, emotional, and neurocognitive issues can include headaches, irritability, depression, fatigue, dizziness, sleep disturbance, and treatment. So the treatment that I chose to cover is treatment for executive function deficits, and this can negatively affect everyday activities, which include planning meals, paying bills, keeping a schedule, making decisions, because you're depending on the severity, but your brain, doesn't. It's been shown in scans, brain scans, that your brain actually doesn't retrieve the information as efficiently um, as as those that have not suffered from TBI. So one type of treatment that has been shown to be effective is metacognitive treatment, and under that is a treatment called goal management training, which is a type of metacognitive treatment, and it draws on improving like essential life skills that a lot of patients with TBI actually have problems with, and find that that impairs their functional living skills. And this type of treatment has been shown to be effective with veterans and with different types of patients that have suffered different types of TBIs included, like with falls, car accidents, assaults, basal ganglia stroke. So this type of treatment has been shown to be effective for different types of patients. It was originally designed to take place over 7 weeks, but the two studies that I found were actually modified the treatment. One of them did it over 10 biweekly trainings, meaning over 5 weeks, and 10 trainings, and another one actually took place over 10 2-hour sessions and 3 1-hour sessions. And the training involves 5 stages that are necessary to obtain your goal, and the end result would be, you set a task that you want to complete, and you go through the 5 steps, and sometimes you have to backtrack if you find that there was some kind of where your plan fell apart. You sidetrack and you move back to the prior step until you can achieve your ultimate task. And this part that's very important with the goal management training is that you actually really, if there isn't, you really focus on the breakdowns, and you make sure that you learn from them, and you start the process again. If you wherever the breakdown occurs, for instance, a simulated task would be making dinner, and you're running around the house, you're picking up stuff, you're moving from one room to another, and you notice that it's getting close to dinner. The first thing that you would do is you would stop and you acknowledge that what you're doing, and then you go to stage 2, which is you acknowledge the main task that you actually that needs to be done, which in this case would be making dinner. You go on to stage 3, and then from there you list the necessary steps necessary to complete your task. And then for stage 4, you assess each of those tasks, and you make sure that you can complete each one, that you're capable of completing each one. And if you're not, then you have to revert back to step 3 and figure out what task you're not able to complete, and be able to complete steps necessary to complete that task. So it's a lot of going back and teaching the client to really analyze and their actions, and to be able to create self-awareness, and to be able to self-reflect, so that you can learn from those breakdowns, and that hopefully you will be able to complete your end task, which is what a lot of people from TBI suffer from, and actually say they need a lot of help in. Thank you. That's the end of my presentation.